But if you are someone dealing with spine and disc pain, every day can tend to feel just like the last. Functioning on a daily basis can actually be very difficult for those who suffer from this type of pain, and even finding some relief may seem almost impossible, leaving many feeling hopeless. However, Dr. Don Palmer, he is a chiropractor and international herniated disc specialist who has treated over 1,300 of the most severe disc sufferers from all over the United States and even from other countries as well. He joins us now here to share his treatment methods. So a very warm welcome to you, Dr. Palmer.
Thank you, Melissa. It's good to be here.
It's great to have you. And I understand, too, that you have yet another amazing success story to share with us.
Yes, I do. We're excited to share it.
Okay, well, tell us about this patient.
So her name is Deborah. She gave me permission to use her case, but she came in. She's a pretty typical patient, what we're used to. She had really severe pain going on in her spine that was radiating down her legs and was causing a kind of a pain numbness going on in her ankle and her foot. To the point where she really couldn't walk more than about 10 minutes. And it was really messing up her life. She'd been suffering with it for 2 years, and it had been, despite the fact she's done every conservative and medical treatment that she could think of, it was continuing to get worse. And she was suffering with 10-level pain without medication. And she was at the point where she was fearful that she was going to end up under the knife doing spine surgery.
Okay, and clearly she wanted to avoid that.
Yeah, so we found out about her. She looked like she was a typical candidate, and so we started doing a lot of testing, examination, and ended up getting MRIs on her spine.
Okay, and you have some of those images to share with us right now. So do you mind telling us what we're looking at?
Yeah, so up on the screen we have pre-post MRIs. You'll see on the left side of the screen is the before, and the right is the after. So I know nobody watching this is probably a radiologist, but look in the white space running through the center.
Okay.
You can see that center disc, that black disc is going into that white space.
Yes.
And then on the right side, that was after treatment, 6 weeks, you can see that it has dramatically opened up that nerve space. So that image on the left is basically a disc herniation that is going in and really devastating her nerves. And then I have another shot of it as well, which is an axial view where we're looking right down on top of the spine. So again, on the left is the pre-image. You can see that black surface going into the white center space. That is the disc herniation going in there, and it's hitting nerves. And then on the right side, you can see that that white space is all opened up now after treatment. And that's basically the results that we got on her pre-post images on MRI.
Wow.
And remember, these are discs that were considered permanent damage in the past, and now we're able to make dramatic changes to them.
And you did that without going under the knife?
We did that completely non-surgically. In fact, she was sleeping while we were doing the treatment.
Oh my goodness.
Yeah, she feels so good with it.
Okay, so very evident that she had some very significant improvement. Were there any other results that she had too?
Yeah, so as a result of that, within about 3 weeks of doing the treatment, we had cut her pain by 55%.
Wow.
And enabled her to function better. And then by the 6th week, when we were done with treatment, she was almost 78% improved. And then over a 6-month period of time, as the nerves continued to heal, she got to a point where, remember, she was only doing about 10 minutes of walking and she couldn't do it anymore.
Yeah.
She lives in Utah, by the way, and she does extreme hiking. Anywhere from 7 to 10 miles she does.
Really?
Up crazy steep hills. Yeah, she's doing phenomenal.
So for hours now, when she could barely even walk for 10 minutes before.
Yeah, so it's improved her work. She said everything took her twice as long to do. Her chores and tasks at home, time with family. She said her social life was completely devastated.
She has a whole new life.
She has a whole new life, yes.
Whole new life. And so for those watching that are suffering from severe neck and back pain, how do they know if your protocol is something that can benefit them?
Well, the only way for us to really know is to do ask a lot of questions. So we have a screening process that we do when people call to make sure they're in the right place. We have an examination that we're going to be doing as well. That's a 19-point evaluation that's critical to determine what their diagnosis is. And so through that process, we can determine whether a person is really ideally suited for the treatment and whether it'll be very effective for them.
Okay, and then you have a special offer too.
Yeah, so that examination that I mentioned, that 19-point examination, we offer for patients to really help to diagnose their condition. And we do that free of charge for your watchers for the next 5 days.
Right, and Dr. Palmer, where can our viewers go so they can set up the appointment to come see you to see if you're able to help them just as you did this woman from Utah?
Yeah, so up on the screen, they'll have my phone number and it'll have our website that they can go to, DrDonPalmerDC.com. And they can get in contact with our office, and my staff will then take their call, ask them a bunch of questions, and see if this is right for them.
Wonderful. Dr. Palmer, thank you so much. You never know, some people watching, they may be taking their first steps towards their whole new life, whole brand new life as well, right?
Yes, thanks for letting me share the story.
Yeah, we appreciate it.
The following interview involves commercial content. The products and services featured appear as paid advertising.